Hi, this is Jamie Hadfield, and I am with Legends Health, Wellness, and Performance, and I have created a 100% organic, non-GMO CBD product line so you can live a happier, healthier life. Today we have a functional medicine consultant, Ryan Darrow, who has been in the functional medicine field for five years, or he's worked for a company called Designs for Health, which is a manufacturing nutraceutical company, high-end quality nutraceutical company that he's been with for 5 years, and the company's been around for 30 years. So welcome, Ryan.
Thank you, Jamie. Glad to be here.
Yeah. So tell us how you became interested in the field of nutraceuticals.
Yeah, thanks. So I've been in fitness and nutrition for well over 20 years and worked with athletes and other individuals in the fitness industry and nutrition ever since the beginning. And of clinical experience working with doctors, having bad experience with pharmaceutical drugs, and having my own health challenges, being diagnosed with Lyme disease a while ago and coming through that and healing myself from that using no drugs, no antibiotics, using nutrition and using alternative health practices. My mind and my life was completely transformed into how we can heal the body safely without side effects, using a combination of therapeutic values of vitamins, minerals, amino acids, and herbs to really reset the body and to get rid of the things that are making us toxic.
So, right, because I know you go out and you consult a lot of physicians every day. That's what you're doing, is going and consulting healthcare professionals on nutrition. And today, from a nutrition aspect, an average chiropractor, I read this statistic somewhere, an average chiropractor gets 300 hours of nutrition training, where an average physician, MD, gets 16 hours of training. And if this is, both you and me believe that the nutrition is information for the body and it can actually heal the body. But there's a lot of physicians out there, and you're fighting this every single day. There's a lot of physicians out there that don't believe in the nutraceutical side of things, the nutrition side of things. What's your approach to that? And how can we change? And how can we change that paradigm? How can we get physicians to shift?
I wish the answer was easy. What I can tell you is in my practice, I have to meet practitioners where they are. And we've both probably experienced practitioners who don't believe other than what they've learned in the textbooks. And maybe they haven't spent the time reading the published articles in the peer-reviewed journals. Maybe they're afraid. Maybe the clinic or the hospital chain that they're a part of doesn't allow them to venture out. There's legalities and things that they're concerned with. So sometimes they're just not quite ready, and they need their own life experience sometimes with a family member or themselves to really see the value of being able to reset the body nutritionally. So sometimes, unfortunately, we have to wait for them to be ready, because there's a lot of practitioners out there who do see the light and they are ready and they want to learn more and they're hungry. And those are usually the practitioners that I work with, teaching them protocols and formulas to treat their patient's illness with medical grade nutrition instead of drug. Like your Legends CBD is an amazing product line that's getting great results, helping practitioners treat patients safely, getting them off of opioids and other, maybe SSRI antidepressants. That there's other ways and there's better ways. It's just what we are informed about in our culture doesn't really allow for a lot of that alternative medicine just yet. But the more consumers demand it, the more and more consumers these days are turning to their healthcare practitioners to find high quality supplements, because the stuff that's on the shelf in health food stores and at retailers is not always safe and clean. And that's the biggest concern with the supplement industry, is do you really know what's in the bottle? The supplement industry is almost a $200 billion a year industry now.
Wow.
And when you get an industry that's big, it starts to open itself up to counterfeit products. In maybe the clothing industry, that's a bit safer, but we're talking about materials that we're ingesting into our bodies that are designed to make us healthier, and we have to be extremely careful. So that's what I was hoping to getting into today, is helping your followers and consumers in general understand, have you ever really thought through what's in that bottle?
So that comes down to, because I know the FDA, the government has came out with good manufacturing, GMP practices, and I think there's a controlled manufacturing, good manufacturing practices as well. When companies on the shelf, let's just say at Costco or even Walgreens, or I go down to my grocery store and I see vitamin C, vitamin D, right? What's the difference when we're looking at that? What should people be looking at?
Yeah, great question. The first thing that I think consumers need to think of is really mean better. And the most expensive product or supplement in this case isn't the one that costs more, it's the one that doesn't work. So a lot of times retailers will entice us as consumers with low prices. The challenge is you take lower quality raw materials, you're getting lower end manufacturing practices. You mentioned GMP, or good manufacturing practices. Believe it or not all nutritional supplements, in fact most nutritional supplements, are not produced through FDA inspected certified facilities. That's where GMP, or those good manufacturing practices, come into. For example, Designs for Health, okay? One of the 4 largest functional medicine or nutraceutical formula suppliers in the country. Been around 30 years, started out as an educational company. They were practitioners looking for better solutions. So they were practitioners in practice, treating patients, looking for additional resources, looking at the supplements that were on the market, and just weren't finding things that they trusted. So then they began to manufacture products on their own. Now today, 30 years later, with more than 300 formulas in their line, is an international company now, and is a practitioner brand.
And exclusively a practitioner brand.
Correct. And not even all practitioners can qualify for a license. It depends on the background or the level of training that they have, and it can be tough for some practitioners who don't meet the requirements. But you know, when you say you're a practitioner brand and you have therapeutic formulas you need to be careful with, there has to be a definitive line somewhere. So what happens in manufacturing, there's an organization called the National Sanitary Foundation. We work, or Designs for Health works closely with the National Sanitary Foundation to make sure that we're meeting those good manufacturing practices, so that when the FDA does come in to do their inspections, that we can pass with flying colors and stamp each product with that GMP stamp. And I urge consumers to, when you go into a store and you look at products on the shelf, if the bottle doesn't say good manufacturing practices or FDA inspected facility, then I would be extremely leery of that, because even attention retailers could potentially be putting a product out that's not meeting label claims. Or, well, let me give you a really good example.
Okay.
So at Designs for Health, anytime a raw material is received from anywhere around the country, it's first quarantined. That raw material is taken in quarantine, and it's tested for mold, spores, bacteria, viruses, any kind of organism. It's also tested for heavy metals and lead and other things to make sure that it's safe and that it's clean. Quite often we have rejected raw materials from around the world and have fired vendors because their materials were not up to grade. The other thing that's also important to test for in that quarantine process, if it's an herb or a plant, is it the right plant species? And often enough, It could be the wrong species. Let's take ginseng, for example. You have panic ginseng, you have American ginseng, you have different forms of ginseng. Some are more potent and more expensive than others. I've seen cases where we thought we were buying Korean ginseng, and it turned out to be mostly American ginseng with just a little bit of the Korean sprinkled in. Those kind of scrupulous activities go on all the time in the industry.
So on the bottle though, it just says ginseng. Like I wouldn't, it doesn't say American ginseng. It doesn't quantify that, because our labeling practices, even the ones that are FDA, managed, is not that specific. So how do people find, if they do want to be that specific, how do they find that information out?
So a lot of times that information is not clear on the label. At Designs for Health, when you look at a Designs for Health product, you will see the type of material that it is, and it'll even give the scientific name and what percentage of standardization that it goes through. Is it 95% standardized, which basically means how concentrated it is. If you look at homeopathics as a category of products that you can buy in a health food store, it'll have the scientific name of the concentration of the material that's used in those homeopathic pellets. So there are companies who are doing the work who try to be as transparent as possible, and there's other times where we're not getting that information. That's why it's so important, if you want a high quality supplement, to really try to go through a practitioner who knows what they're doing and working with brands that are going to protect us from those type of problems.
So with manufacturing, I would think consistency, that you're putting all the time, that you have quality control measures in place, that the consistency is coming out, milligrams per, of the product. How are you guys regulating or controlling or quality? What are the quality control measures for consistency?
Yeah, great question. So that's where that quarantine process really comes into place. There's at least 4 steps of quarantine that happens with manufacturing a product in one of our facilities. So when they first come in, each raw material is tested, like I mentioned, for those organic organisms, for the heavy metals, and that it's the right species. And then as materials start to get mixed together, they're tested again, because when plants and vitamins interact, anything could happen where maybe a potency is diminished. And making sure that you want to meet label claims, those testing processes happen all the way throughout manufacturing, to make sure that interactions don't cause a depletion of potency. Once we've tested that there's no mold in it, that we know the heavy metals are in check, and that it's the right plant species, from then on there, once you know you have the right material and it's clean, it's all about continuing to test for potency so that you're meeting label claims. So each time more materials are mixed together, it's quarantined, tested for potency, and then there's a final inspection. Once the final product is all blended together properly, ready to go out the door, there's a final quarantine process to make sure that no interaction caused a decrease in potency before it goes out the door. And a lot of times companies like Designs for Health will even manufacture products at a little above label claim to make sure that as the product starts to age on the shelf, that you're still meeting label claims.
That is impressive, so impressive. Just because I've picked up, I'll just tell you, one day I went and bought coconut milk, and in the coconut milk, I just looked up the ingredients on the back of the coconut milk, and the ingredient, when I looked it up, was actually paint thinner. It was just white, it was a white paint thinner. And so I think we are consuming so many products that we believe that we are okay for us. They're, generally considered safe items, and we are consuming them. And there's very, very few companies that are looking at toxins and molds, because that's another thing. I just don't think physicians have gotten trained on toxins and molds. And I know that you go quite in depth with your training. So can you tell us a little bit, or how are you educating the physicians on that side of things?
Well, it's a very important question, and like your coconut story, looking to see what was in the product. We trust we trust manufacturers as consumers. We're told to trust the FDA. It blows my mind how sometimes the FDA will approve something that's really untested on humans. And in a lot of ways, we're guinea pigs. Even with the interactions of different drugs, you know, when a drug is cleared, the way that it's tested, most of the time, they're not testing, like, how many people do you know that their doctors prescribed them something, they went to the pharmacy and filled it, that they only have one drug that they're taking? That almost never happens. You usually have a closet full. You take something, it's supposed to help you, and then it creates another side effect, so they give you another drug to combat those side effects, and then all of a sudden you have a whole cabinet full of drugs. Well, your unique interaction of all the drugs that you're taking, they haven't been studied that way. So we're really acting as guinea pigs for big pharma and for the insurance companies. I don't think that they necessarily mean harm, but to try to satisfy the needs of the growing population, even in our food supply with all the toxicities in our food, like in the coconut milk with the paint thinner that's in it. There is a ridiculous amount of things that go into our products that we don't even think about. And take pickles, for example. That's a big one. Almost every single pickle on the shelf in the grocery store has polysorbate in it. I've only found 2 pickles. One of them is an organic one by a company named Woodstock. Can't remember the name of the other one, but every other pickle on the shelf has polysorbate in it, which can be cancerous. There's so many things that they allow into our food supply that should not be in our food supply. Even something as simple as the anti-caking agents in Kraft macaroni and cheese that's in the powder, the pesticides that they put in our food, the number of bug parts that they allow in canned food. It just blows my mind. And a lot of the health conditions I think that we're seeing in our country today have a lot to do with the food that we eat, the toxicities in our food, the lack of our ability to detox, the genetic modifications that are happening, and the hormonal disruptors that are happening. We hear a lot of times about BPA that's in water bottles, and they try to get BPA out of water bottles. Your bottle is BPA free. Well, there's a BPB that's also a hormonal disruptor. Every single canned food is all lined with BPA. The receipts that you pick up at a grocery store, those have BPA in them. Major hormonal disruptors. And our bodies just spin out of control. So in working with practitioners, when they want my advice, a lot of times when I first go in and I start working with them, I'll look at everything that I have on their shelves and I'll ask them if they want me to review that. And we'll look at them, and we'll look at the bottle, and we'll say, okay, this one has artificial sweeteners in it. This one has gums in it that aren't necessary. This one has other preservatives in it that you shouldn't be exposing your patients to. There is a better way. And whether it's with the company that I represent or another company, I find it personally important to try to help them gravitate away from those products that aren't GMP certified, that haven't been properly tested, and that have those toxins in them.
I think this is really huge because of stuff, but we're believing that the FDA has our best interest, and you just mentioned 100 different foods, right? Pickles, and I mentioned coconut milk that doesn't have that's not clean. But like I said, and I used to work for a pharmaceutical company, and I helped put 15 different drugs in clinical research. So that is the space that I actually come from, and I don't think they have your word. I mean, they're a company, and they're just trying to make a dollar. I don't think that this aspect of things, most of their physicians that are running the protocols, I had no idea when I was running the protocols. I had no idea about all these other things that go in. Look at when I was running the drug studies, we did look at the different medications that they were on. The average 55-year-old is on 5 or more medications, and you're right, we have never studied those. We've absolutely never. So the question here is how can we educate the public? How can we educate the physicians on manufacturing practices and why they're important? Because in both your and my perspective, that's what's getting people sick. That's what's one of the. It's not the cause. It's one of many causes that are causing chronic disease. And by one, do we go and fight them one by one?
Everything is driven by politics and consumer demand, and until consumers start to demand more and more responsibility out of legislation, it continue to get better, and consumers have to be willing to make the more expensive choice a lot of times, but the right choice and the better choice. Remember in the beginning I said the most expensive supplement is the one that doesn't work or that makes us sicker. One thing I think it's really important to share right now is that buyers really need to be aware of purchasing supplements online from anywhere directly than from the manufacturer. You put yourself at a big risk because the industry is as big as it is. You get companies from all over the world who are taking fake bottles, putting fake labels on them, putting fake white powders in capsules and selling them as high quality supplements. Buyers need to be extremely aware, and all of the big third party purchasing sites that we all like to use have these counterfeit products being sold on their websites. If you go to let's say just some online retail store, as long as you're buying it directly from the manufacturer, there's a good chance that you're not getting something counterfeit. If it's not directly from that manufacturer, then anything goes. They'll put it up on their site. There's a lot of counterfeit products that are on the market that are being sold to us. It could be baking soda, it could be who knows, it could be just any kind of white powder that's in those capsules. Not only are you not getting the therapeutic value, but you can make yourself sick, and they're making a ton of money off us. So it's really important that if consumers are not going to take our advice here today and they're not going to look for high quality GMP products, at least please do not buy your products online unless it's direct from manufacturer. Not only is there a problem with it being counterfeit, but there's something called the chain of custody. And each time products are made and moved from warehouse to warehouse, if that chain of custody isn't controlled, it could have been sitting in a hot post office warehouse somewhere before it got to whoever was ultimately selling it. They could have completely denatured all of the herbs and made them useless, and there's that risk as well. So even the best intentioned retailers are not always testing, and we don't always know what we're getting. I'll give you an example. There was a study that was done a couple years ago where the FDA went into a bunch of health food stores and pulled a whole bunch of fish oils off the shelf and did comparison studies. And what they found was that more often than not, those fish oils were rancid and they weren't even meeting label claims. But us as trusting consumers thinking, you know what, I go and buy my stuff in bulk at this place and I can get a whole vat of fish oil for really cheap. So I'm just going to buy it there because I trust that place that I shop. Or the local health food store that has a lot of, and we trust them. And you know what, we should trust them. I'm not suggesting people be paranoid, but even the companies making those products don't always know what they're getting if they're not GMP certified.
Or they don't have that quality assurance, like you said, right?
Exactly.
When they're testing the raw products. I know in the CBD space, I've tested products, gotten the raw product, and they told me that I was buying a full spectrum CBD, and it came back as a isolate CBD. And at the time, I wasn't educated enough at the time to really know the difference. And so I was stuck with a kilo of isolate when I thought I purchased a full spectrum.
I bet you never went back and bought from them again.
No, I never did. Yeah, no, I never have. So I think it's really important that people are, I think that's what I'm trying to, is the authenticity and the trust, because there's so many, there's just a lot, everybody's just trying to make a buck.
Right.
Everybody's just trying to make a buck. And that's not what's gonna get us healthy. That's not what elevate our life in any way. That's not gonna make us have contagious energy. And really that's what we're all striving for, is to have a better life.
Yes. We deserve to find the best for ourselves in that regards.
That I think every one of us needs to say that, right? I am deserving. I think so many of us get in a loophole and we don't feel deserving, or we do this negative self-talk to ourselves. But we deserve the best food, we deserve the best energy that we can actually put into our bodies. I know with Designs for Health, they focus on a paleo diet. Can you kind of expand a little bit more? Have they given you some training?
Yes, for sure. You know, what we put into our bodies, food, is critical. If we don't get the food right, unfortunately, the supplements are going to have a marginal effect. That's where it all starts, is with the food. The supplements are designed to supplement the food, making sure we're getting the right nutrients in our body. So when you look at a paleo lifestyle, for example, we've held strong to that. We do things with keto, and we have supplements that support a ketogenic lifestyle. But if you look at paleo, there's a lot of different paleo templates, and it's changed as they've analyzed the Paleolithic human, and they've looked and they've seen, you know, the scales on their teeth and the different things that they're learning about the Paleolithic diet. Really what we're talking about is clean meats, clean fruits and vegetables, some grains in limited quantities. Wheat are usually very safe grains. So when you go to what's called a paleo template lifestyle, you are allowed some of those grains and legumes that they're learning, like rice, for example. They found scales of rice on the Paleolithic teeth. They're finding that the Paleolithic humans, they had more than what we originally thought. It wasn't just, they were just, you know, omnivores that ate animals and you know, fruits and vegetables. Like, they went a little bit outside of that. I subscribe to the belief that with food, it's about learning your truth and what speaks to your body, and doing all things in moderation so that you can find a lifestyle that supports your unique genetic makeup. You know, it's a process. We have to make steps and strides, and every day it's really about winning the battle at the fork. We all have bad days, we all have good days. Some of us have addictive personalities and some of us don't. Some people, if they're going to have a cheat meal, they need to have a cheat day. Other people don't want to have cheat days, they just want to have small cheat meals. So I believe it's really about finding what's right for that person's spirit. And some people do really well with intermittent fasting and other people do not. So when I'm talking to a practitioner about implementing a dietary lifestyle, they need to be flexible and listen to their patients. And just because they did intermittent fasting and it worked for them, or they lost 30 pounds on a keto diet, you know, people with thyroid issues don't do well on keto. So there's things that you have to be careful of. So it's really about finding your truth.
Why is that? Why? Because lots of people are going to want to know that.
Well, that's something that they should certainly research, and it's a very deep discussion, and there's a lot of research that's currently going on in that field of ketogenic lifestyles, and how it affects the thyroid hormones and how it can suppress the production of certain thyroid hormones. So if a person already has a thyroid issue, you know, maybe they have a hypothyroidism type issue or Hashimoto's. A lot of times people who have thyroid issues are the ones who won't lose weight with keto. But you have to think about the way our bodies are made up. Genetically, our bodies need carbohydrates. Our body, the mitochondria in every cell of our body that produces energy to find glucose to create energy. It's normal. There are some doctors who will say they could do keto their whole life. And bless their souls that they can find that and stick with it. But again, it goes to helping people transition their lifestyle and making steps in the right direction.
I'm gonna say, just because I've suffered with Hashimoto's, a thyroid disorder, most people on thyroid or have thyroid issues probably need to go more on an autoimmune protocol type diet, which eliminates certain foods. The most foods are gluten, dairy, nuts, seeds, eggs, nightshade vegetables. So that's what going on autoimmune, if somebody has a thyroid issue, that's what they would need to stay away from. And then they would need to also make sure that they stay away from those toxins and take good supplements. And so when I first started on this journey, I was reading about this, and I was when I went to go purchase the supplements. The purchase of supplements was $600. So when a big issue for
Worse.
to right or persons come to, I can't afford that. What's the most important supplement for me to take? And that depends, right?
Yes.
That depends on what's going on with the person. So how are you guiding the physician? I mean, because that's a lot of education that you're doing, on, okay, cost comes into factor. So what are you telling the general public when it comes to cost? Because, I mean, I'll tell you my opinion. My opinion is that of not spending the money on the supplements is you're going to spend on hospital bills. So I'd rather pay the cost now, a little bit of the cost, for the long term. What's your take on that?
I love the question, and the first thought that comes to mind is we're all imperfect, including our doctors. And sometimes practitioners overprescribe, even supplements. And they're trying to run a business, and they're trying to learn how to be a businessman, and they want to help their patients, or a businesswoman, and they want to help their patients. And it's very common for doctors who are all in with functional medicine, typically your naturopaths and others who are really all in with the supplements, that can overprescribe too many. And having too many bottles, you get what's called pill fatigue. And it's hard to take. With a $600 supplement bill, you've probably.
That's good, yes.
It's a very real thing, and we get burned out. And as individuals, we'll go through cycles. And I'm really gung ho this week, and I take all my supplements 3 times a day, like my doctor told me. And a lot of times, it's about slowing down, addressing the major issues for a few months, seeing what kind of progress we make, and see what symptoms remain. The problem, though, sometimes is not only the physician, but the patient will dump all of their problems on the physician and say, I want you to fix everything that I'm suffering from right now. So they're willing to buy all of those pills. But the reality is that sometimes some of our symptoms are just a manifestation of a different problem. You got to find that magic key of what's going on with that person. And it's not easy to be a doctor in practice, but we all need to realize our doctors are humans. They're barely a little bit smarter than the rest of us, and they have their flaws too.
We know what's best for our body too. Though.
We should.
We need to pay attention, right? I know it feels. I know when I eat something. Yesterday we had a great big birthday party here at the house for my one. I ate the sugar, right? I ate the cake, I ate the ice cream, the gelato, and afterwards I went to go play basketball, and I couldn't play basketball. Like I didn't have it was not the right food for me to go actually physically use that way. And I know yoga has been a really big thing for me to be able to pay attention, to separate my mind and my physical body, and be able to help me decipher and be in tune. And so I think people really need to learn whatever that is for them, however they learn that for them, they need to be able to decipher in themselves, okay, is this going to make me feel better, or am I going to feel worse after consuming, eating this item? And then what are my plans for the future? I think a lot of people ask me, and I'm to the place now where I want to be able to go hike the top of a mountain. And so I live my lifestyle so any day somebody can invite me and I don't have any problem going and hiking that top of the mountain. Where I listen to all these people and they have to go train, or right, they're getting ready for. It comes down to consistency. You want to live that way. And I think that is, I think as I've aged, that's more important to me than how I look. It's how I feel.
How we feel. You know, what you experienced when you had the cake and the gelato is very common for people who get clean. Once we get clean, we get all the toxins out of our food supply, we start to consume some of those things, they make us sick. It's not uncommon for people who go gluten-free for a long period of time that when they consume gluten, that they and some of the research is now suggesting that people with celiac and gluten intolerance, it's not actually the gluten that they're allergic to, it's the pesticides and the chemicals that are in the plants.
Wow.
So there's people who are starting to consume organic, cream of wheat or whatever it may be, and they're not having the gluten intolerance effect that they would normally have, because they say a lot of times it's about the seeds, it's about the wheat that we're growing here. Why can you go over to Italy and eat pizza and pasta and not get bloated and sick? Well, they have a different seed supply. It's a different grain. And anybody from America who has traveled to Italy and has eaten pasta every single day and felt great doing so wonders, well, why can I eat pasta at home and get sick but not over here? It's really about the toxins in the food supply, not necessarily the gluten. And for a lot of people, maybe not everybody, but for a lot of people.
That's so interesting, because yesterday, again, my niece was over here, and I have she's probably 8 years old, and she's overweight.
Yeah.
And she was complaining of her heels, her, plantar fasciitis, and then I had a nephew that, probably 10 years old, he's having some feet problem too, the plantar fasciitis. So plantar fasciitis is inflammation, right? It's inflammatory, and I couldn't help thinking, oh my gosh, oh my goodness, if parents could take that away from them, then this plantar fasciitis just might go away.
Yeah.
And so then there's that whole dynamic, because I know a lot of parents, their children are sick and they're trying to take away, but you can't. If you sit at a friend's house and there's pizza and the kid is gonna eat the pizza, right? The kid's gonna eat the pizza. So I think that's another issue that's parents are facing, and this all comes down to manufacturing processes. It really comes down to the manufacturing processes, that we just don't have them in place, and finding a trusted source like Designs for Health that has quality, consistent certificate of analysis, make sure the product says what it claims it to be. That is what and that goes into our food sources, that goes in everything.
And our cosmetics and our soaps, and
yes.
It's a big problem with the hormonal disruptors. And think about the scents in the lotions and the soaps, and there's a big problem with everything that we put on our body, and the sulfates and everything that goes into our toothpaste and even our shampoo. Like right now in our house, we're trying to get rid of all of the toxic chemicals. You think of the non-stick pans that we cook with. There's toxins in our world that they allow into our environment, and the list climbs every single day of these chemicals that are approved, and it's making people sicker and sicker. Systemic inflammation is the #1 killer in our country. Sugar causes systemic inflammation. Bugs cause systemic inflammation. The foods we consume cause systemic inflammation. It leads to cancer. It leads to arthritis. It leads to plantar fasciitis. It leads to autoimmune disease. every condition that we suffer with in our country has a root in systemic inflammation. And until we start buying better supplements, we start buying more organic, better, cleaner quality foods, until we start really looking at that beauty care and health care products that we put in and on our bodies, we're susceptible. And the people who suffer more than others, we're learning now in the field of epigenetics, the people who are suffering more are the ones who have genetic mutations where the genetic expression is what's the root of the problem. So why is it that you're allergic to something that I'm not? Well, a lot of it has to do with the way our body perceives that substance and the way our genetic makeup is to deal with the toxicity to shuttle it out of the body. You know, I know this isn't a discussion about vaccines, and I'm not going to really go there on one side or the other, but what we're finding out a lot of days of nowadays with like autism, for example, is these autistic children, whether they've been vaccinated or not, have an issue with their genes, their genetics are not properly detoxing. So it may be not necessarily the vaccination itself that maybe cause autism, but the toxins that go into those products and other products that those parents are giving their children that can cause autistic expression, and they're on the spectrum because their genes are not helping them properly detox. And when a person's genes are not properly expressing, any number of those toxins that the body isn't able to get rid of can cause a number of inflammatory processes. So it's really about digging into everything that's in your cabinet at home, really taking a self-inventory and making decisions for your children and for your own health if you truly want to get better.
So when I started on my journey, I had to eliminate, right? I had to go through an elimination phase before my body was actually ready for a detox phase. And I don't have the detox pathways. I have those gene mutations as well. So when you're educating physicians, are you telling them to trying to eliminate them before the detox? What's your process with that?
It really depends on the practitioner's specialty and what they feel comfortable. Some, like you mentioned, chiropractors earlier, some of them only feel comfortable talking about pain and using things like fish oils and anti-inflammatories and, you know, dealing with acute injury because they don't want to step too far outside of that. They want to find a safe space. And most of them that are new to functional medicine, it's a process. Okay, first I'm going to start treating pain, acute pain. Then, you know, I realize that the gut is an issue. So then I'll start treating the gut. Then I'll start treating infections. Then I'll get into detox and diet. It really just depends on meeting the practitioner where they are, trying to respect their boundaries, respect their knowledge. I know earlier I said that practitioners barely know a little bit more than the rest of us. I don't think that came out very, what I had meant to say was, you know, a lot of them are very brilliant. But for everybody, practitioner or consumer, it's a journey. And we all need to, you know, just daily chunk away at that journey a little bit.
Okay, so one more question that I have for you is, there's this big, there's this big in the industry, CBD and cannabis, and is it considered a supplement? Is it considered a drug? In your eyes, what is it considered? Is CBD considered in your eyes?
Something that needs to be brought to the world to eliminate the side effects of a lot of other drugs that people are taking. We could help so many conditions. The opioid epidemic is a very real thing. Directly, CBD or the hemp plant in general is something that the world should have access to. Now, there is the potential for, you know, the whole marijuana plant, where people with addictive personalities and you take too much of it, and like, I get that there needs to be regulation, and I truly believe there needs to be regulation. However, when you're dealing with people who really need it and can use it responsibly, we also have to listen to them. But I think it does need to be regulated, but I think it should be available to everybody. Now, you're seeing nowadays that there was just a pharmaceutical drug that was released, a CBD drug that was released here this year, that is now sparking a brand new debate that it can't be a supplement because now it's a drug, and it can't be both. And they're trying to shut companies down,
Yeah.
reputable companies, because now all of a sudden it's a drug, because our world is seeing how valuable it is, that we don't know what the legal landscape is going to be, but I've just seen it do a number of things for so many different people, whether it's, you know, mental health conditions or pain, in seizures. It's just this remarkable plant that has so many wonderful things to give, that if we can find a way to make it safe, then it, yeah.
Well, I want to make sure that, you know, again, because this is about manufacturing processes, that CBD companies, when they're consuming their CBD products, that they are that GMP certified, and they have the best practices, and they're looking at the toxins and the molds. Because I've seen polysorbate, I've seen citric acid, I've seen guar gum, I've seen I've seen a lot of CBD companies put it in plastic bottles, right? And the CBD adheres to the plastic bottles and releases the BPA. So there's so everything that we've talked about, that you and I have talked about, is also extremely important in the cannabis space as well.
Let's for a quick second talk about manufacturing of CBD. So hemp, it's called a weed for a reason. It grows like a weed. It is a weed. Part of that is it acts like a sponge. Hemp will absorb all of the nutrients and toxins and molds from the ground. Hemp is a material, it's a plant that can mold very, very easily. It's something that you have to be extremely careful with. And I know when I first came in contact with Legend CBD, when I looked at your product, I could feel the energy of it, and I could see that the clear color of it was extremely important to me, because when you manufacture CBD, if it's dark, has a lot of flavoring agents, is really thick, that means it hasn't been properly refined. They haven't gone all the way through the refining process. CBD should either be a clear liquid or it should be a golden color. Anything darker than that means that it hasn't been refined all the way, and you're still getting solvents, you're still potentially getting molds, and anytime they add flavoring agents to it and artificial sweeteners, they're trying to mask that unrefined flavor. If it doesn't look clean and it doesn't taste clean, it's not clean, and I would completely avoid it.
Thank you. No, I do know that people need to also look at how it's extracted. Is it CO2 extracted? Is it ethanol extracted? Is it hydrocarbon? Because that depends on the quality of the product, the end product. If it is a CBD isolate, I don't know what designs. What do you guys carry? Do you guys carry an isolate, or do you guys carry a full spectrum?
We carry 3 full spectrum products. Isolates are not how the plant was intended to work in the body. You know, with the way CBD deals with homeostasis in the body, you really need all those constituents.
Okay.
The isolates.
So I agree with that, but I will say, because isolate will come up, you're less likely to come up positive on a drug test, and so they've just isolated out the CBD. So from my personal perspective, I don't necessarily care as how it was extracted, because they're going to keep extracting it until it's they just have that one compound of CBD. When it's a full spectrum, I completely agree with you that it does, the extraction method that they use, and usually an isolate that I found is really, really clear in color. Your full spectrums are more of a clear yellow in color.
Like a golden.
Yeah, golden, amber. If it's really dark amber, then it is probably not been refined, like you said, and it probably has a lot of the solvents in it.
Yeah, gotta be careful.
Yeah, we have to be careful, because it's here we're taking a product that's supposed to help us with inflammation, and therefore, you know, it could have toxins in it that is causing inflammation. So we're not, you know, there's a fine balance there.
Yeah.
There's a fine balance there. Well, thank you for your time.
Thanks for having me.
Yeah,
I appreciate it.
We really, really appreciate it. So please check out, or go talk to your practitioner and get some designs for health. One last question I'm going to actually ask you is if there was one supplement that I should take, what should it be?
A proper multivitamin, multimineral. Every function in our body Every metabolic process in our body requires adequate levels of vitamins and minerals, and it really is the most important thing that we have the right balance of vitamins and minerals in our body. And then from there, you know, it really depends on the person's condition.
Okay. Okay, there we have it. So start taking a multi-level, multi-level, a multivitamin.
Multivitamin, multi-mineral.
Yeah, thanks for watching. This is Jamie with Legends Health, Wellness, and Performance, and Ryan Darrow.
Thank you.